We are live. Welcome, everyone.
Welcome.
Welcome, everyone, to the Melanin Initiative. I'm Dr. Kimberly Madison, a Dr. Howley prepared nurse practitioner, and one of your co-hosts here at the Melanin Initiative podcast. In healthcare, there is often too much information and not enough time. Here at the Melanin Initiative, we avoid TMI by breaking things down into language you can understand. We create a safe space for you to ask your questions and share our nursing perspective without taking too much of your time. Today, we'll be talking about diabetes. This is a big one. And we have a special guest, Dr. Mark Smith. He is both a pharmacist and a diabetes educator. It doesn't get better than that. And we're so happy to have him on the show, and we are so thankful. Today, by the end of the show, we hope that you'll be able to talk about what happens to the body when you have diabetes and potential complications. You'll be able to name the test that we use to monitor your risk for diabetes, discuss how we diagnose you with either prediabetes or diabetes, identify what to do to prevent diabetes, name some common symptoms you may experience if you have it, and comfortably discuss some of the most common treatment options. As a friendly reminder, this show is only for educational purposes. The opinions expressed are our opinions alone. They are not a representation of any of our affiliations. If you're experiencing a medical emergency, you should seek medical attention and medical guidance from your healthcare provider. So let's get started. Dr. Smith, do you want us to call you Dr. Smith?
It's okay either way.
Okay.
Dr. Smith, Mark Smith, it's totally fine.
Okay, you're gonna be Dr. Smith today. Welcome to Melanin Initiative.
Should I change my my signature down at the bottom?
Oh no, you're good. You're good. People don't read anyway. They're just
Okay.
They're just gonna remember what we said.
That's the most important part. As long as they remember what you say and take heed to the words that you say as well.
Absolutely.
So in healthcare, we're pretty familiar with your job titles, but if you can, please tell us what you tell people you do for a living.
Yeah, sure. So by trade, I'm a pharmacist. I've been practicing for over 10 years now in the field of pharmacy. Graduate of Auburn University here in Alabama. And after I obtained my Doctor of Pharmacy degree, I did a year of residency training in outpatient work with the county health department, where we saw patients and treated them with conditions such as diabetes and also cholesterol and hypertension. We ran, as residents, we were responsible for maintaining and running a diabetes clinic where we met with patients on average about once a month and via telephone or in-face person-to-person interaction, where we essentially just followed their diabetes journey, whether it was a person that was newly diagnosed or if it was a person that was, maintained, controlled or uncontrolled. And our job as residents at the time was to basically follow them and make recommendations, make adjustments, insulin titration, medication changes, et cetera, to get them on the path to a better health. And essentially, that's kind of where the passion for diabetes grew at. And it prompted me after that year of residency training to pursue a certification in becoming a diabetes specialist or diabetes educator, as it's formally known as. In today's language, we're called diabetes care and education specialists, but it can be interchangeably used with diabetes educators. And so, it's just a group of individuals, healthcare providers that really put an emphasis on diabetes education and really driving home the importance of knowing what to do with your condition, not be defeated by it, and basically give them the tools they need to maintain and, own their condition and not look at it as a sentence, but look at it as a journey to how I can, continuously, battle this thing. And so that's where the passion grew in at. I work currently at the University of Alabama at Birmingham Hospital, formerly known as UAB, in a dispensary role where we dispense medications and everything like that, and also do diabetes education on the side. And so that's my career in a nutshell so far. I've seen pretty much several different aspects of pharmacy, but at the end of the day, diabetes care and education has kind of been one of the driving forces behind my career, and just sort of excited to kind of do my part as a healthcare provider.
Is it appropriate to say Roll Tide?
In this case, it is. I will say that I have classmates that I graduated with from Auburn University that will, you know, not be so warm to that roll tide. They would say War Eagle uh, for the Auburn thing, and but for me, I was actually born and raised an Alabama fan,
Mm.
and so I'll give you a roll tide back. How about that?
All right. Okay. That's something I learned from somebody I follow on YouTube. He's a super supporter.
Oh,
So,
really? Is that
yeah.
right?
Uh-huh.
That's amazing.
Alicia's going to tell us about the 4 different types of diabetes to get us started.
Thank you. As we know on the Melanin Initiative, we always start with the definition. So there are 4 types of diabetes. They are type 1 diabetes mellitus, type 2, gestational, and diabetes insipidus. Our focus today and the most common is going to be diabetes type 2. So the CDC defines diabetes as a chronic or long-lasting health condition that affects your body, that affects how your body turns food into energy. So there are 3 types of diabetes that affect this particularly, and that's type 1, type 2, and gestational. So type 1 diabetes is thought to be caused by an autoimmune reaction. The body attacks itself by mistake. This reaction stops your body from making insulin. Type 1 diabetes is usually diagnosed in children, teens, and young adults. Unfortunately, you can't prevent type 1 diabetes, and it does require lifelong treatment. Type 2 diabetes is the most common form of diabetes, and it means that your body doesn't use insulin properly. It used to be called adult onset diabetes, but we're now seeing it in children as well due to high carbohydrate diets and less active lifestyles. Type 2 diabetes is preventable. Types of diabetes due to other causes include neonatal diabetes and maturity onset diabetes of the young, cystic fibrosis and pancreatitis, drug or chemical induced diabetes, such as with steroid induced and the treatment of HIV and AIDS, and after organ transplantation. And last but not least, gestational diabetes is diabetes that can occur during pregnancy. So, Dr. Smith, why don't you tell us what happens to your body when you have diabetes? And you can start from the top of your head and work your way down to your toes.
Okay. Okay. All right. So, from an ingestion standpoint, the moment that you ingest a food source, which is going to primarily be in the form of carbohydrates, you're going to ingest that particular substance, and it's going to enter your system. Immediately after you do that, within minutes, you're going to notice an increase in your blood sugar. That's going to happen anytime you have a food source that is rich in sugar or carbohydrates, which is the most simplest form that our body digests sugar in. Once that happens, a person that is a non-diabetic person, they will notice an increase not only in the level of sugar in their blood, but at the same time, they're going to notice an increase in the amount of insulin. Now, the importance of insulin is it regulates how well the sugar is controlled. Insulin is responsible for bringing that sugar from the bloodstream and have it delivered to multiple parts of your body. That includes the different organs such as the brain, muscular system, digestive system, any type of system that you have in your body. The insulin's job is to transport that sugar from your bloodstream to those different systems in order for your body to function properly. So one of the biggest misconceptions is that I'm not going to have any sugar or I'm not going to have any carbs. That's not a terrible approach, but it's also important to understand that your body needs fuel in order to function. And carbohydrates is one of those many forms of fuel. So now we can have a conversation in just a moment about different types of fuel, but if we're just keeping it simple and talking about sugars, this is what happens when the sugar enters the blood. The insulin takes it from the bloodstream and has it transported to the different parts of the body. Now, you also have different organs where the insulin comes from, which is the primary source, which is the pancreas. The pancreas secretes insulin and it takes it from the bloodstream to the different parts of the body. And you also have another organ, the liver, which stores the carbohydrates for future use. So you have the liver, which when the body needs that fuel source, it can send out sugar to the rest of the body. And there you have, you're able to perform any type of function. And what are those different types of functions? We like, why do I need these fuel sources? Well, you need your heart to pump blood. You need your brain to fire off neurons. You need that fuel to do the things that you subconsciously don't think about. Inhaling and exhaling, putting one foot in front of the other, replicating cells. The things that we don't think about are the fuel sources that which the carbohydrates, which is our primary source of fuel, provide the organs with that information and with that fuel to do that job. So we look at high insulin, which is increased because of the increase in sugar into the bloodstream, to where the body can now do its job. And so that's the main portion of how of what happens when sugar enters the bloodstream. Insulin goes up, insulin comes in, snatches the sugar from the blood and distributes it to the rest of the body for functional purposes. And the remaining portion of it, you also have the liver, which stores that excess sugar. Now, when a patient is diabetic, this is where we have our potential problems. So the last thing we talked about was type 2 diabetics. So with type 2 diabetics, they have something known as insulin. They're insulin resistant. So in normal conditions, we have the sugar levels go up. That's no big deal. Insulin comes in and says, hey, okay, let me do my job and carry this sugar from the blood to the different parts of the body. Well, a patient that's diabetic, they become insulin resistant. So when that sugar goes up into the bloodstream, the pancreas does its job by secreting insulin, but essentially what happens is the insulin doesn't hold up its end of the bargain. Insulin gets secreted, but it's like, you know what? I don't feel like working today. Let me just pretend like I'm doing something. So it doesn't carry the sugar from the blood to the necessary parts of the body, and therefore the blood sugar remains elevated for an extended period of time. Now, over time, eventually it goes down. And as you see on this screen here, it dictates what it looks like, where under normal conditions, we have sugar that's in the blood, which is totally fine. But also when a person is diabetic, we have excess sugar in the blood, and that's due to the insulin resistance of not carrying that sugar and distributing it to the rest of the body so that the body can use that for fuel. And what happens when the sugars remain elevated into the bloodstream for an extremely long period of time? Before we talk about that, we can look at some of the symptoms. So if you know a person is diabetic, you will start to feel certain symptoms beforehand. And one of the three biggest things that I always tell patients is the big three: increased thirst, increased hunger, increased urination. Those are the big three symptoms that if a patient comes in and they're complaining about that routinely, one of the things you want to do is really look into, an A1C test, which I'm pretty sure we'll talk about in the slide as well. But one of the hallmark ways to test a person's blood sugar to see what status they are when it comes to diabetes. But as you can see here, increased thirst, also known as polydipsia. It's also called that. You have conditions that make it difficult to heal. For example, if you cut yourself with a knife or something like that, it makes it difficult for the wound to heal because you have excess sugar into your bloodstream. You may notice a patient or a person, they'll start to get lethargic or increased fatigue. Blurry vision is also a common manifestation of a diabetic patient. And as we mentioned, the increased urination. And then the very last one down here, it says unexplained weight loss. Now, weight loss can be can happen very rapidly because of that insulin resistance. And also on the flip side of that, a patient may experience weight gain as well in a type 2 diabetic patient. So I typically tell patients weight fluctuations, because initially, if a person is type 2 diabetic, they may experience an extreme amount of weight loss and they don't know where it comes from. But over time, if it's left untreated, what you could see happen is weight gain because of that, because of that particular reason. So that's an important thing to consider as well.
Excellent. So you mentioned the word carbohydrates and sugar, and I know Alicia kind of agree with me on this. That is where our problem starts, because people look at sugar as something sweet. And so as long as they don't eat cookies and cake, there's no problem. So how do you address that carbohydrate what that really means and how it doesn't. So, and that there's that whole thing. I got the sugars. Grandma had the sugars.
Yeah.
That's been passed down in our family and our generations for so long. It's ingrained in people's brain. And even if we have this show and we sit at the bedside and talk to them for a long time, or they come to the retail pharmacy and you give them a booklet, they're still going to go home, focus on the things that are sweet.
100%, and that is unfortunately an ongoing problem when it comes to the education, and that's one of the reasons why individuals and this platform here is providing them with the necessary education, and a big portion of that education is this: carbohydrates are not bad, and I think the biggest misconception is, like you said, grandma has the sugars. I got to stay away from anything that's remotely sweet. So those are two separate concepts, but we can break down both of them. So the first part is carbohydrates are bad. As we mentioned earlier on, the primary fuel source of our body to function subconsciously, meaning the things that we don't think about that's happening while we're not thinking about it, carbohydrates are usually the main source of fuel. So the first thing I try to tell patients is recognize this: when you're not thinking about things that are happening to your body, carbohydrates are burning in order for you to function just standing upright. That's what's happening right now without you doing anything about it, right? So that's one avenue that we have to go down and understand that carbohydrates aren't necessarily bad. And the second piece, when it comes to things that are sweet, and to your point, yes, we do have a misunderstanding when it comes to, if it's sweet, I'm not going to go nowhere near it. Okay, that's fine. That's one approach to it. But what's going to be your alternative? So like, now what are you going to go through now? So now they're going to go to something that they may not think is sweet, but what's going to happen? It's going to cause increases in blood sugar as well, because they don't have necessary education or information. So for example, something like cornbread, right? It's not necessarily sweet, unless it's Jiffy Mix, of course, but
right.
it's not necessarily sweet. But what happens is your body, once it breaks it down, it's gonna have a high amount of carbs, and it's nothing complex about it. It's a simple sugar. It breaks it down to a simple sugar. And so, yes, things that are sweet, it's automatically in tune to think, okay, yes, this can cause increases in my blood sugar if I'm not extremely careful about how I approach this situation. On the flip side of that is, we have to understand all carbs aren't created equal. So there are different types of carbs. You have simple carbs, which is typically the kind that we think of when we're explaining diabetes to someone that's afraid of it, like sugar, candy, anything you can think, like when you're counseling patients. Those are primarily the simple carbs. Those are the ones over time that could really do the most damage if you're not extremely careful. Like if you're not following the rules of moderation, if you're not really on it when it comes to testing your blood sugar. Those are the ones that are going to get you in the long run. Now, you also have carbs that aren't as damaging and can actually serve some purpose when done effectively. Those are your complex carbs. Those are the ones that come equipped with fiber, things that you need to increase satiety and make you full longer, so that you're not as apt to want to eat more. You have simple carbs and you have complex carbs. Most of your like your brown rice, brown bread, things that are predominantly whole wheat, even some of your vegetables have complex carbohydrates in there. They're not different from simple sugars, into the fact that they both end up getting broken down into that simple sugar, which the body uses for fuel. But it's a matter of how quickly are they broken down into that simple sugar. When you go to something extremely sweet, remember, that's the simplest form. The body breaks it down so fast, and that's why you get that huge spike so early in your blood sugar, because it's already in its simplest form, right? So we have that increased spike. When you go on the flip side of that and you look at something like a complex carb, like a brown rice or a legume or something that's complex, it takes longer for the body to break it down into its simplest form. And that's not a bad thing. We actually want a more of a steady state of insulin and sugar to go up, as opposed to the simple part, that increased spike. So we want that over time. And so that piece of explaining the difference to a patient between simple carbs and complex carbs, usually when you explain that piece and they understand it, that starts to make the world of a difference. And you can actually see that light bulb go off in a sense of, okay, just because I have a piece of candy, it isn't the end of the world. But I also know that if I sit and have a plate or a bowl full of something that's considered a simple sugar, and I have diabetes, I'm doing myself a disservice, as opposed to having something that is a complex carb and having more complex carbs in my diet to allow myself that control when it comes to my insulin levels and when it comes to my blood sugar not spiking and going up and going down. That's a huge teachable moment, and that's usually one of the first things I start with when I do an initial diabetes education session. I try to make sure that I don't let them leave until they understand the difference between something simple versus something complex, and know what it does to the body when you consume something simple versus something complex.
Yeah, you provided some great examples, and even fresh fruit is a great example. And from my nursing perspective, at one of the hospitals I was at, I was a diabetes champion. So a bunch of nursing staff, we would meet with the diabetes educator, who was typically a nurse, and they would and give us education, and we could bring that back to the unit, both for patients, but for also our colleagues. And one thing they used to always enforce is, we want our patients with diabetes to eat their fruit, not drink it.
Mm.
Unfortunately, there's so much juice in the hospital, and I can't find a fresh apple. So in the hospital, it's very challenging. And actually, I'm on a mission, maybe through this platform, to revamp the availability of diabetic-friendly food in the hospital, because it's challenging. Because you've done your work as an educator to tell patients, how to stay away from certain things, like certain kinds of rice and pasta. And they'll be like, look, they brought me rice and pasta, and they're confused as to why the kitchen is bringing them this when they know they're on a diabetic diet. So.
Right.
That's a conversation. That's a whole
It really is.